Hi, this is Ball State Medical News. My name is Alex St. John,
And I'm Corinna Good.
and we're here tonight to talk to you about an outbreak that's been sweeping the streets of Muncie. It's Haemophilus Influenza B, also known as HIB.
So this is a type of bacteria that can cause different kinds of infections, including pneumonia, meningitis, cellulitis, and even ear infections. It might sound like it's a type of viral infection, but it's actually caused by a bacteria. And today we're here to discuss how you can keep your children safe and what signs and symptoms to look for in this disease.
Absolutely. So the HIB is transmitted through the air when a person coughs or sneezes. Symptoms can be developed of HIB depending on what disease develops, as she said, depending on the bacteria. For example, with meningitis, would include a child with a stiff neck, light sensitivity, changes of consciousness. For pneumonia, symptoms might include fever, coughs, chills, difficulty breathing, and chest pain. The bacteria can potentially infect the bloodstream, and these symptoms would include fever, fatigue, diarrhea, and again, difficulty breathing. So if your child presents any of these symptoms, if their friend presents any of these symptoms, it's very important that you contact a medical professional or take them immediately to the emergency room. If they did contract this disease, they need to be administered antibiotics as soon as possible to treat the bacterial infection. The antibiotic included would be ceftriaxone or cefotraxone for the meningitis. Most antibiotics used for the treatment of HIB are given orally. And they also include amoxicillin, azithromycin, cephalosporins, and also others. Children are still considered contagious for up to 48 hours after antibiotic treatment has finished, so it's very important that they stay home from school and avoid friend-to-friend contact as well during the course of this treatment.
Although this disease can be very serious if it's contracted, the incidence of this has decreased substantially since there was a vaccine created for it. So for children that are younger than 5 years old, the incidence is actually 0.18 cases per 1,000 children. So this disease occurs mostly in children that are too young to receive the vaccine, which is why it's important to vaccinate those that are able to get it. Like we talked about earlier, HIB is easily prevented with the administration of the HIB vaccine. There are different types of vaccines available for HIB, and it is also important to discuss which brand of vaccine will work best for your child with their healthcare provider. The 3 vaccinations are administered in order to provide the strongest protection against this type of bacteria.
As she said, the first vaccine is administered at 4 months of age, with a subsequent vaccination at 6 months. And the final dose is a booster dose, and it can be administered anywhere from 12 months old to 4 years old, depending on which brand of vaccine is used. Overall, HIB has a relatively low incident rate in children, and vaccinations have been proven to be effective against the bacteria. However, if your child does contract HIB, it's very important that they stay informed on the treatment process. Don't be afraid to ask questions. Make sure to be a support system for your child. And the better you are informed, the less stressful this process will be. Luckily for us, we have a great team of nurses that we brought in today to ask some more questions to get to the bottom of this disease. All right, now thank you ladies for joining us here at Ball State General.
Hi, my name is Caitlin Hansen,
I'm Lindsay Black.
and we're going to be here to answer some of your questions about this disease.
Great, so first of all, what is the best way to prevent this disease from occurring?
So the best way to prevent this disease would be the vaccination. There's a HIB-specific vaccination that you can talk to your doctors about before receiving.
And what symptoms are you looking for in a child that possibly has this?
So we have prepared a little handout for everyone that is interested, and we will link below our video. But some generalized symptoms that you would see would be fever and chills, cough, shortness of breath, sweating, chest pain, headache, muscle pain, or tiredness. And depending on where the bacterial infection occurs in the body, you may also contract a bacterial meningitis or pneumonia, which was discussed by our news anchors earlier.
All right, and all the parents are wondering, is it contagious?
So this disease is contagious, so it's very important to keep your child home from school if they have any symptoms that you may suspect being HIB until they finish their antibiotics. And you want to make sure to teach them to cover their mouths and their noses when they cough to prevent them from spreading this disease.
All right, and Lindsay, over to you. What age groups are most at risk for contracting this disease?
So infants that are too young to be vaccinated, so basically infants under 4 months old, are at high risk for this disease just because they don't have that immunity yet from the vaccine. And then children that have not had the vaccination at all are also at risk. And then immunosuppressed children are also at a high risk for developing or contracting this disease.
All right. Thank you, ladies, so much. Is there anything else that is important that we need to know about this disease?
So just make sure that you're practicing basic hygiene, like washing your hands before you eat, making sure that you're hand sanitizing in public places, or when you go somewhere and touch things, make sure that you're washing your hands and hand sanitizing so that way you get all those germs off. And then also, if you know anyone or one of your child's friends is sick, make sure that they avoid contact with them until they're not contagious anymore.
Awesome. Thank you, ladies. And I'm looking forward to looking at the pamphlet and spreading that out with our viewers. Thank you, guys.